leave tonight with hope, and know that we can do so much that we didn't know a generation ago. So I'm excited to share this with you. And so we'll just go ahead and get into it, and we'll start from there. Okay, so I do have my thumbnail picture up there, just so you know it's a live person speaking to you. And if that's in the way of any of your images on the screen, you can just move it, click and drag, or just put it off to the side. But it's nice to know that there's someone really speaking. I welcome all of you. For those of you who are familiar with Brad Bale and myself, we have worked together for over 20 years now, and we have focused our efforts on arterial inflammation and scouring the literature over the last 2 decades to understand how we can stabilize inflammation in the body, which ultimately leads to health. So as a brief introduction, we have 3 clinical professorships, one at Washington State University College of Medicine here in Spokane. We are assistant professors at the University of Kentucky College of Dentistry, and we are adjunct professors at Texas Tech University Health Sciences School of Nursing in Lubbock, Texas. And we are the co-founders of the Bale-Doneen method. I hang my hat every day at the Heart Attack and Stroke Prevention Center here in Spokane, Washington. And Dr. Brad Bale has a private practice down in Nashville, Tennessee. Okay. So the outline we have for you today is the following. Let's just talk briefly about some of the statistics. I think it's important to put it in perspective that this is a very common disease that we're talking about, and to put some numbers around that is not meant to scare anyone, but to put it in perspective. And as we move forward, I want to then go into the idea of how the Bale-Doneen method relates to brain protection. And then I'm going to discuss several root causes of Alzheimer's disease. And the good news is all of those root causes are treatable. Then I'm going to close tonight with 10 action items that we can do right now to protect our brain and preserve our memory for a lifetime. And many of these things seem quite simple, but putting them all together yields terrific benefits, because ultimately what we all want is to have our health span match our lifespan. Okay. How common is this? Almost 6 million Americans over the age of 65 have Alzheimer's disease. It's important to understand real quickly the differences, because these words are used synonymously sometimes, dementia and Alzheimer's, and there's really not a clear-cut definition when we're just describing the symptoms of Alzheimer's, which is ultimately memory loss. So dementia is used as a word to describe a chronic or persistent disorder of the mental processes caused by brain disease or injury, and marked by memory disorders, personality changes, and impaired reasoning. Alzheimer's disease is a progressive mental deterioration that occurs in middle or old age due to generalized degeneration of the brain through 3 main pathways. One is the formation of amyloid plaques, neurofibrillary tangles, often driven by something called tau protein. And then finally, the deposition of amyloid B, which triggers brain dysfunction of the neurons, which then leads to memory loss and everything we have discussed. Approximately 70% of dementia is actually due to Alzheimer's disease. Do you know that 1 in 10 people over the age 65 actually have Alzheimer's? 1 out of 3 people over the age of 85 have Alzheimer's disease. Everyone's going to present differently, and everyone's going to present at different levels of cognition changes, but 1 out of 3 people over age 85 have some form of Alzheimer's disease. Matter of fact, someone is diagnosed with Alzheimer's every 65 seconds in this country. The average survival is 4 to 8 years after a formal diagnosis. Alzheimer's disease is the 6th leading cause of death in the United States. 1 out of 3 seniors die from Alzheimer's disease. So it's not quite as unique sort of rare as sometimes we think it is. Matter of fact, between the years of 2000 and 2017, we've made tremendous impacts on the death from heart disease. It's decreased by 9%. However, the death from Alzheimer's disease has increased 145%. And there's lots of reasons for that. People are living longer. We have, therapies that help treat other diseases of aging, so people live longer. Therefore, the death that causes demise is Alzheimer's disease. But that we can change that. There are also gender and ethnic differences with Alzheimer's disease incident. Let's talk about that a little bit. Do you know that 2/3 of Americans with Alzheimer's are women? 2/3. 1/3 are men. When compared to whites, African Americans have a 2-fold higher risk of Alzheimer's, and Hispanics have a 1.5-fold higher risk compared to white individuals. Let me describe this a moment because I think it's an important graph to look at. So if you look at the areas in gold and light blue, you'll see that the actual prevalence of Alzheimer's has been quite stable for some time. The gold shows stability in ages 75 to 84, and it shows that curve is flattening, and this is projected out to 2050. However, the trend is certainly increasing, and the trajectory is a linear progression in the way we don't want to see for individuals over age 85. But it has been stable in people under the age of 85, and I think that's important to realize. If we don't do something different and change what we do today, the projections say that 13.8 million people age 65 and older are projected to have Alzheimer's dementia by 2050. Access to care is also a realistic challenge that needs to be recognized. Currently, most Alzheimer's patients are unable to see a specialist due to the deficiency of medical experts. There is an urgent need to solve this shortage to meet the projected increased demands of Alzheimer's. We've got to do something different. Part of the reality is oftentimes there's a challenge of whose job is it? By the time people are referred to neurology, oftentimes the symptoms are so advanced. Sometimes families struggle to find someone to grab hold of their care. And so as healthcare consumers, we need to be educated and we need to be very proactive with our own health so that we can have a different future than oftentimes our parents and grandparents had before us. Costs. Well, this is big. In 2020, Alzheimer's cost our nation $305 billion. The projection by 2050, if the trend continues, is $1.1 trillion to the nation to deal with Alzheimer's related issues. The current cost to family and friends is $244 billion. So, take a breath, because when you hear these statistics, they are scary. But I will argue, and we will argue, that it is a time to be hopeful because we know more now than we did then. And matter of fact, the Alzheimer's Association most recently stated the following, and I quote, "A treatment that prevents, cures, or slows the progression of the disease could substantially mitigate the growing prevalence, the escalating costs, and healthcare shortage related to Alzheimer's." So then the question begs to be asked, is there a treatment that prevents, cures, or slows the progression of disease? We would argue that there is. We would argue also that we need to be hopeful, and the time is now to be hopeful and energized with the fact that science has brought us to a level now that we can see a different future than our parents and grandparents as we've watched them struggle with memory loss. What we have learned about vascular health systemically has demonstrated protection of the microvascular system and the brain. Ultimately, as we care for the heart, we also are caring for the brain. You know, our bodies are just a series of highways of little vessels, tiny little vessels, really no bigger than a human hair, to be honest. Some of them are. And it's projected that we have over 30,000 miles of these little vessels. So what we understand with the larger arteries we treat, as far as identifying causes of inflammation and treating those, The sideline benefit of that is we have the ability to protect the brain and the eyes and everywhere throughout the body, all the way down to the toes. We have spent a long time studying this, and we learn every day, which keeps it exciting and keeps it dynamic. But several of our publications point to the fact that we absolutely can identify, stabilize, and regress atherosclerosis, which is plaque in the arteries, and we can remove inflammation from within the body that drives chronic diseases like Alzheimer's, vision changes, peripheral vascular disease, kidney disease, etc. So the data supports that what we're sharing with you tonight is not anecdotal. There is real science behind the ability that we should be hopeful. So I'm going to show you a brief cartoon that's about 2 minutes long. And rather than me explaining to you what the Bale-Doneen method is, I'm going to show you a cartoon we created that has my voiceover, and you'll be able to see what the Bale-Doneen method is. So I'll go ahead and play that now.
The 9 foundational elements of the Bale-Doneen method, which necessitates a paradigm shift in cardiovascular disease prevention. Our algorithm is called EDFROG-IRA, and I want to describe to you all 9 elements of our method. The E stands for education. It is critical that we start with education. We call this event reality. It is essential to first understand what causes a heart attack or an ischemic stroke. We refer to heart attacks and strokes as events. The D of our method stands for disease. It is essential to find out if you are harboring silent, dangerous, hidden plaque in the artery wall. This is called arterial disease or atherosclerosis. We often refer to hidden disease as a cat in the gutter. It is important to also monitor this disease over time. We use non-invasive, safe, effective, and cost-effective tools to accomplish this. The F in EDFROG stands for fire or inflammation. Events are triggered when the disease becomes inflamed. Determining and monitoring the inflammation is extremely critical. Measuring inflammation is accomplished by using simple urine and blood tests, allowing an understanding of your arteries to be stable or inflamed. The R stands for root causes. Identifying the root causes of vascular and arterial disease is an essential step. Without this knowledge, the disease can smolder until there frequently is another event. Using techniques perfected through the Bale-Doneen method, we can determine the true root causes of your vascular inflammation and halt the arterial atherosclerotic disease. Root causes include conditions such as cholesterol, blood pressure, insulin resistance, periodontal disease, endodontic disease, gut dysbiosis, psychosocial issues, airway and sleep, nicotine, infectious and autoimmune diseases, even low vitamin D, and others. The O stands for optimal. Setting optimal goals for modifying risk factors rather than goals set by the standard of care is necessary. We do follow the standard of care. It is a legal term. However, we believe you deserve better. You deserve to be treated as the unique, wonderful individual you are, and we use genetics to help base our treatment decisions. Remember, optimal care equals individualized care. Genes is the G of our method. Rendering care that is individualized as opposed to treating people as the average produces superior results. You cannot get any more personal than your genetic makeup. Genetics is the future of medicine, and the Bale-Doneen method stays on the cutting edge of this rapidly evolving field of medicine, both to assess an individual's risk, pharmacogenetics, and treatment recommendations for lifestyle, medications, and even supplements. The IRA is quite simple. It means we individualize our management. The above 6 elements are combined to design a very personalized treatment program. Each patient is regarded as a unique, precious individual requiring therapies designed specifically for them. The R stands for risk factor response. The risk factors targeted for management in each patient are monitored. Adjustments are made to strive for optimal control in every treated issue. Assessment, finally, of disease response. Annual arterial structural testing is performed to ensure that therapies are having a positive effect on the atherogenic disease process. This, after all, is an extremely important goal to ensure our ultimate purpose, which is to prevent heart attacks and ischemic strokes. The Bale-Doneen method has coined an acronym to remember these 9 ingredients. It is called EDFROG IRA.
Okay.
The 9.
So let me bring it forward then, because as you saw in the video, so much of our work has been historically focused on heart attack and stroke prevention. And the keystone of our method is really about inflammation. So as we have continued to carry our work forward and understanding Alzheimer's disease is actually about brain inflammation, that's why it's so exciting to understand that what we've learned over the last 20 years actually applied and applies to brain health. Inflammation is a key characteristic of this neurodegenerative disorder called Alzheimer's. Therefore, suppression of inflammation constitutes a major therapeutic strategy to prevent Alzheimer's disease. The Bale-Doneen method has vascular inflammation as the keystone, the absolute keystone to describe health or disease. So, let's talk about some of the root causes of arterial inflammation that are the same for Alzheimer's disease. I'm not going to talk about all of them, but I want to highlight a few that have great research behind them. And I will tell you that as we highlight some of these root causes of brain inflammation, what I'm really excited to tell you is that they're all treatable. They're all treatable. And when we go back to close the talk this evening, I'm going to give you the top 10 things that we have learned that you need to start today to protect your brain long term. And they have to deal with identifying these root causes and treating them. Okay, so to protect the brain, these root causes of inflammation must be identified and treated to maintain lifelong health. Let's look at a few of these root causes. Let's dive into them a little bit. This study was published just a couple months ago, and it looked at almost 200,000 patients over age 60 followed for 6 years. They found that Alzheimer's was associated with several of the roots that we can treat to protect the body from arterial inflammation, things like cholesterol, blood pressure, optimal weight management. Let's start there. Let's start with lifestyle. There's a great study, and it combines almost 3,000 people. It was called the Chicago Health and Aging Project and the Memory and Aging Project. And they followed these people for 6 years. And I'm just going to make it real simple because it is simple. They looked at 5 healthy lifestyle activities, such as non-smoking, getting at least 150 minutes, about 30 minutes a day of physical activity, light to moderate alcohol consumption, diet driven by a Mediterranean or DASH, which is a lower salt diet, and engagement in late life cognitive activities. Then they took those 5 healthy lifestyle activities that we can all do and said, well, let's compare then for those who did maybe 2 or 3 of them or 4 to 5 of them, compared to people who really didn't do them. Is there a difference with Alzheimer's projection? And here's what I'm excited to share with you. Compared with 0 to 1 lifestyle factors, if all we did are 2 to 3 of these lifestyle factors, Alzheimer's was reduced by 37%. If we did all of them, Alzheimer's was reduced by 60%. Compared to people that didn't follow those 5. And they're real simple. I'll explain them again. Non-smoking, physical activity, light alcohol, Mediterranean diet, and cognitive activities. The only reason I put this bar graph up here is to show you one thing, and that is when you look at those individuals who do 4 to 5 healthy lifestyle factors, it was statistically independent, meaning it didn't matter how much someone weighed. It didn't matter what kind of exercise they did. It didn't matter. Everything outside that window, just doing those 5 activities was statistically independent to reduce risk of Alzheimer's by 60%. Well, that's exciting, isn't it? Let's look at cholesterol. Does that have a role in brain health? Absolutely. Do you know that if your total cholesterol is over 200, the risk of Alzheimer's is increased by 23%? If the total cholesterol is greater than 250, the risk is doubled. Therefore, maintaining cholesterol under 200 should be a priority to help prevent Alzheimer's disease. So, find out your cholesterol and get it treated with lifestyle and sometimes therapeutically if needed. Let's talk about blood pressure because that's a biggie. That's a biggie. First, I want to start with, do you know what normal blood pressure is? The old way of thinking just a couple years ago was that it was acceptable to have a blood pressure under 140/90. That as long as it was under 140/90, you're good to go. Well, what we've learned, if we want to protect the brain and the small vessels in our body, that's not good enough. Normal blood pressure, and I want you to remember this, is now 120/80 or less. Anything above that starts to cause inflammation in the arterial system and causes potentially changes in the brain as well. When you look at the idea of maintaining a blood pressure under 120/80, you see all these things are improved. And I highlighted just the dementia and Alzheimer's piece of this. But whether we look at our brain, our eyes, our kidneys, all the way down to our toes, if we simply optimize our blood pressure, we can make huge changes down the road. Let me show you one more. When they looked at 4 million plus individuals ages 30 to 90. They followed them for 7 years, and they showed that blood pressure is continuously related to the risk of Alzheimer's disease. Reducing blood pressure may reduce the incidence of Alzheimer's disease across the board, which is a very modifiable thing to do. What if you're middle age, like myself at age 50? They looked at people age 53 who had blood pressures over 120/80. So not terribly high, but above the mark that we would consider optimal. Do you know that at age 53, having a blood pressure over 120/80 at the age of 53 is associated with brain volume decrease and small vessel disease of the brain by the time we're 70? So what's the lesson here? Know your blood pressure, check it at home, understand what it is, and insist on getting it treated now with things like lifestyle changes, sleep optimization, and even medication if necessary. Let's talk about another big root. It's called insulin resistance. That leads ultimately to type 2 diabetes. But I want you to understand that 80% of people, 8 out of 10 individuals with Alzheimer's are either diabetic or pre-diabetic. 8 out of 10. Insulin resistance is the precursor to diabetes. It's an inflammatory condition of the arteries and the entire body. It often goes on silently for decades before someone is diagnosed with diabetes and ultimately treated. For that entire time, the brain is suffering. The body's suffering. Insulin resistance drives the development of Alzheimer's disease, and sadly, it's not often diagnosed until it's gone on for 20 years, caused damage, and someone is ultimately dealing with brain changes and even now dealing with type 2 diabetes. There's another term I want to bring to light here because you'll see it as you do your own research and look through, but there's a pulse now that Alzheimer's disease is often called type 3 diabetes. Type 1 diabetes is a little bit different giant. That's a situation where either a virus or autoimmune condition attacks the beta cells in the body and they no longer make insulin. So there's a lot of children who deal with diabetes deal with type 1. Type 2 is basically a wear and tear on the pancreas, and it takes, as I said, sometimes 20 years to manifest itself. Type 3 diabetes, they're looking at the brain insulin signaling playing an important role in learning and memory. Levels of brain insulin and insulin receptors are lower in Alzheimer's disease. Amyloid beta proteins redistribute insulin receptors from the dendritic membranes into the cell, rendering neurons, which are proteins in the brain that are key to brain functioning, it renders them insulin resistant. Impairment in insulin signaling instigated by amyloid beta proteins is thought to be a central mechanism by which memory deficit develops, i.e., Alzheimer's disease being called type 3 diabetes. When I go into the top 10, we'll share with you what to do about these things, by the way. Airway and sleep, let's talk about that because that's a biggie right there. I want to talk about it in two ways. One, just simple poor quality sleep or sleep disruption. And then I'll go into the idea of sleep apnea. But this looked at, it took 20 healthy people, okay? It compared just one night of crummy sleep, one night of sleep deprivation, compared to what the brain looked like after a good night's sleep. And they did it by brain scan imaging. It's called PET scan. They wanted to measure brain amyloid beta, those proteins I was telling you about, after getting a night of sleep deprivation. And I will tell you that one night of sleep deprivation relative to baseline, resulted in a significant increase in amyloid beta burden in the right hippocampus and thalamus. So you can see how those amyloid beta just heated up, just lit up on the PET scan after just one night of poor sleep. They even adjusted it for genetic factors, and poor quality sleep affected the brain in that demographic as well. So good quality sleep is an essential element to prevent manifestation of memory loss down the line. Okay, here's something that's really important. If you remember nothing about sleep, please remember this. The biggest risk factor regarding sleep is having sleep apnea and not identifying it or not treating it. Let me tell you why. Untreated apnea, which is inability to breathe, you're not getting oxygen, your airway is obstructed, showed a 2.12-fold increased risk of developing Alzheimer's within 5 years. However, treated obstructive sleep apnea showed a 77% reduced risk compared to the non-treatment. So the ultimate lesson here is it's not devastating to have sleep apnea, it's devastating to not know you have it and ignore it and not getting it treated. It's all about getting tested for sleep apnea and treated properly. There's lots of ways to treat apnea: position, bed changes, oral appliances, sometimes CPAP is necessary, but find out first because your brain needs oxygen every night. When you look at obstructive sleep apnea, whether it manifests itself with excessive daytime sleepiness, poor sleep quality, sleep fragmentation, or intermittent hypoxia where the body just isn't getting oxygen, whatever the symptom from sleep apnea, they all relate to one thing: cognitive dysfunction. So getting good sleep is really a powerful tool in the prevention of Alzheimer's moving forward. And that's something to keep in mind for all of us. Okay, let's talk about oral health, periodontal disease specifically, and how that might relate to brain health. So ultimately, please keep in mind that periodontal disease is an infection. It is. Numerous infections are actually suspected in Alzheimer's disease, ranging from oral and non-oral viruses, bacterial infections, and even yeast. Alzheimer's appears to have a multitude of causes, environmental and genetic, that may act in concert to one another, but infections are never a healthy situation. And if you have an infection in the gum line, it's going to transpose itself into the brain tissue inflammatory-wise very easily. Let me show you something more recent. So this is taking almost 10,000 patients over age 45. They followed them for over 25 years. They looked at incident of Alzheimer's and death from Alzheimer's. Do you know when you have increased pocket depths, when you go to the hygienist and she's poking your gum line and she says you've got pocket depths that are increasing, that's associated with Alzheimer's incidence and death. And when we take it a step further and look at the bacteria that can cause that gum destruction, one of the bacteria is called Porphyromonas gingivalis, or PG. It can stimulate amyloid beta production, which plays a critical role in the pathogenesis of Alzheimer's. PG was associated with an increased risk of Alzheimer's incidence and mortality. So not only is having the presence of periodontal disease associated with it, but if you can identify what the bacteria is that is driving the periodontal disease and inflammation, then we have the option to treat the PG and see that risk go down. And that is identifiable and treatable as well. Okay, let's talk about the gut. The gut's a huge organ, right? And so obviously, if we have inflammation in the gut, it's going to transpose to systemic implications. So let's take a look. There is definitely a gut-brain connection, and we have a lot to learn about this. All of us do, but the data continues to roll in. This literature was published just a year and a half ago. Alternations in gut microbiota can induce increased permeability of the gut barrier and immune activation, leading to systemic inflammation. This in turn may impair the blood-brain barrier and promote neuroinflammation, neural injury, and ultimately neurodegeneration, so the brain degenerating, enhancing the risk of Alzheimer's disease. So inflammation in the gut, maybe it's called irritable bowel syndrome, maybe it's the food we're eating, etc. I'll talk about this when we talk about the top 10, but gut inflammation is connected with brain inflammation without a doubt. Vitamin D deficiency. Do you know, this is interesting, one standard deviation increase in vitamin D reduced the risk of Alzheimer's by almost 40%. How can that be? What does vitamin D do? Right? It does the following. It can reduce oxidative stress. It can prevent neurons from dying. That's the elements in the brain that are so necessary to brain health, and mediate the clearance of these amyloid beta plaques by activating macrophages that go in there and do the work for us. So what level then is optimal? So optimal vitamin D for brain health, heart health, systemic health is around 40 to 60 nanograms per milliliter. And it is a shock how many people are vitamin D deficient in this country, and it really doesn't matter where we live. It is a true problem, and the original, FDA regulations of vitamin D were originally set up to prevent rickets. Well, we're way beyond that now. So even in food, sometimes people don't get adequate supplementation with vitamin D. So it needs to be checked and it needs to be treated. Genetics. Are we just genetically destined to have Alzheimer's? Like, is it just destiny? Let's look. There is a gene, it's called the Apoe4 gene, and we've measured this gene for over 20 years because it also helps us understand how the body breaks down different foods like fats, carbohydrates, proteins, even alcohol. But people who carry the Apoe4 gene, it showed that people with Alzheimer's, about 66% of them had this Apoe4 gene. Roughly 2/3 of Alzheimer's patients carry the Apoe4 gene. But it's really important to point out that many people with Apoe4 do not get Alzheimer's. They don't. But if you have Apoe4, how wonderful it is to realize that you should know what your root causes of vascular inflammation are, identify them and treat them, because if you have the gene, it's not destiny. It means work harder, right? There's something on the horizon. It's called the Klotho gene. It's really not available for prime time yet, but we wanted to share it with you. For people who do carry that Apoe4 gene, and sometimes you'll hear it labeled as the Alzheimer's gene. We don't really give it that much credit. That we give it credit, but we don't call it that. But people who carry that gene, who also carry this Klotho gene, were 36% less likely to convert to Alzheimer's than those who carried Apoe4 and were negative for the Klotho. Klotho is associated with more favorable amyloid beta profiles in the brain. So in the future, for those who have Apoe4, it'll be nice to know what your Klotho gene is too. We just don't have access to it yet, but this field is progressing in a very rapid fashion. So we'll be able to measure that in the future. Okay. So we've gone over 9 different root causes, ranging from cholesterol to blood pressure to pre-diabetes and diabetes to genetics to gut health to all kinds of factors. So what about that then? The only thing you can change ultimately is the future. That's it, right? And only we can do it for ourselves. So let's talk about 10 action items to do right now to prevent Alzheimer's disease. We'll call it our top 10 list. Number 1, lifestyle absolutely matters in this field of medicine. The best diet that's been published to show a prevention of Alzheimer's, as I discussed previously, is the Mediterranean diet. That's diets high in good fats, such as avocados and fish with omega-3s, low on saturated fats, low on simple carbohydrates, and high on vegetables and fruits. A pretty easy diet to follow for most people. Hydration is key for everything, for health, and also in the world of brain health. The thought is, if possible, to try to get half of our body weight in ounces of water. So if you weigh about 100 pounds, try to get 50 ounces of water. If you weigh around 200, try to get around 100 ounces of water a day. That's not a hardcore science as far as the exact amount, but that's a really good guide to go by, and the data supports these efforts. Managing our weight by focusing on where we carry the dangerous fats is also key. So it's not always what our overall weight is, it's where we carry the dangerous body fat. So that's why men who can maintain a waistline under 40 inches are going to have far more favorable health outcomes throughout their lifetime than men who have waistlines over 40 inches. And women, the same data goes for keeping our waistline under 35 inches. And by the way, men, you cannot go by your pant size on this, because you could have a 34-inch pant size and have a belly that's over 40 inches. So you need to measure it properly. So there's fancy ways to do that. And I would advocate just measuring your waist at the thickest area and take a look at that and be thoughtful on that. Exercise. We need to move more as a country, as humans, we all do, but aim to try to get about 30 minutes of cardio every single day. And cardio means that your body's working, you're breathing a little bit harder than maybe just a stroll, but everyone's fitness level is different. So what we want is for you to move and increase your breath and get exercise from that. And at least 2 days a week, do resistance training, because that technique, those combinations actually really help sort of push people away from insulin resistance and type 2 diabetes also, but also decrease inflammation within the body. Consider all types of exercise. You don't have to be a runner. You could dance, you could do Zumba, you could do Tai Chi, you could do yoga, you could walk, you can bike, you can dance. All kinds of things you can do for exercise. There's no hard and fast rule, but one recommendation we always like to say is enjoy it. You know, life is short at the end of the day. 100 years it can be in a blink of an eye. So what you do for 30 minutes a day, enjoy it, right? And also don't smoke and avoid secondhand smoke. We talked about that previously in the literature as one of the top 5 lifestyle factors that can reduce your risk of Alzheimer's moving forward. So absolutely, if you smoke, stop. If you're around someone who smokes, don't be around them, and support them in their quitting efforts, because it does not help the microvascular system at all. Okay. Number 2, healthy brain activities. That's a big one, a huge one. So keeping our brain active is sometimes easy when we're working, right? Like the executive functioning, the thinking, the brain hand connection, all of that is required when oftentimes people are in the workforce. When people retire, it becomes an effort to make sure we're still exercising our brain like we're exercising our body. So there's a lot of ways to do this, and it's key. So don't think that you don't have to exercise the brain to maintain its health, just like you have to maintain muscle to maintain body health. So mindfulness is a wonderful tool, and the data supports to try to be mindful at least 15 minutes a day. There's all kinds of apps for this. Sometimes mindfulness is thought to be meditation. One app that's really popular is called Calm, and it kind of talks you through different ways of mindfulness or meditation. But the most simplistic definition of this is to place yourself in an environment for which you're present, of your breathing, for which you're kind of trying to get away from the riffraff. And that's really important. And mindfulness, 15 minutes a day, has proven to affect blood pressure favorably, brings down chest pain, brings down blood sugar, brings down blood pressure, and even improves sleep onset and sleep efficacy. Okay, a very cheap medication, mindfulness, affects 5 different categories and also protects the brain. So keep that in mind. Mental stimulation, listening to music, learning a new language, doing puzzles. Lumosity is a great program because it compares you against you, and it looks at 5 different areas of cognitive functioning. So it's something you can do on an iPad or on your computer. It's actually kind of fun, and you can then do it on a fairly regular basis and make sure that you're not decreasing in any area of executive functioning. And if you're challenged in one of those areas, the AI, or artificial intelligence, within that program starts giving you tools to improve the brain function in that area. So it's pretty cool. Volunteering, learning a new instrument, all of those things help protect the brain. Social engagement, book clubs, current events discussions. A lot of people heading into the ages of 75 and older, perhaps our parents or friends and family, while they may be aware of current events on television, rarely is a discussion had on that to allow people to process their thoughts. So that's something else. Having conversation, dancing, using technical tools also can be a way to engage socially, especially during the time of COVID. So teaching people how to do Zoom and engaging in that format. And then, of course, laughter. You know, laughter improves blood pressure, and it improves nitric oxide, which is a really important molecule for arterial inflammation. So laughing also improves brain health. That's pretty good as well. Let's circle back to the sleep. So number 3 on our top 10, get adequate sleep. Sleep quality and quantity impacts beta amyloid deposition, disrupts blood pressure, increases weight, leads to insulin resistance, and even diabetes. Find ways to measure your sleep quality and sleep quantity. There's things like an Oura ring. There's certain beds like the Sleep Number bed that has value. There's wrist devices that monitor sleep quality and sleep efficacy. So those are things we all should really be aware of to make sure we are getting decent sleep. And then with sleep apnea, get tested and get treated if need be. Untreated apnea causes atrial fibrillation, Alzheimer's disease, and it also causes something called death. So identifying sleep challenges is a key factor to protect our brain long term. Vitamin D optimization. Get your vitamin D level checked. This is a fat-soluble vitamin, so you can overdose. Test your level before starting treatment and while on treatment. The goal is to maintain a level of 40 to 60 nanograms per milliliter. Taking roughly 2,000 to 5,000 international units of vitamin D3 is usually effective to do this, and that's an over-the-counter supplement. But make sure you know your level before you just jump on board with that, because you can get toxic levels, which are very dangerous. Oral health. Oral health infections, i.e. periodontal disease, can infect the brain and inflame the arteries. These pathogens are associated with amyloid plaque development, Porphyromus gingivalis, or PG, has been identified in brains of Alzheimer's patients on biopsy, where they've actually found that bacteria in the brain of patients on autopsy diagnosed with Alzheimer's. And they've also found it in the cerebral spinal fluid of Alzheimer's patients who are living. So we know for a fact this pathogen, this PG bacteria, can cause infection in the brain matter and cerebral spinal fluid. Oral health providers like dentists and hygienists are critical members of the healthcare team. So make sure you visit your dentist frequently, see your hygienist even more frequently, and have optimal home care as well. Cholesterol, don't forget about cholesterol. Know what your number is. Ideally, you want it under 200. Watch the ratio, total cholesterol to HDL ratio. The goal is to see that under 3.0. Remember, HDL is brain food. When HDL is allowed to be under 40 versus greater than 60 for men and women, it demonstrated a 53% increased risk of memory loss. Know your cholesterol and get it checked, and know your numbers. There's a lot of thought out there that cholesterol, if it's too low, can be bad for the brain. Well, here's what we want to share with you, that 20% of the body's cholesterol is in the brain. Cholesterol does not, in the body, cholesterol does not cross the blood-brain barrier, because the brain makes its own cholesterol. So as we treat cholesterol, oftentimes necessity out of medication, the fear is not that cholesterol can go too low, that it affects brain health. The brain makes its own cholesterol. And that's something really important to realize. Our bodies are built to survive. So the body intuitively is going to make molecules to the best of our ability to protect us. So keeping cholesterol in check is vitally important. So keep that in mind. The brain makes its own. We need to keep these systemic levels appropriate. Blood pressure optimization. When do you measure blood pressure? The data supports that measuring blood pressure first thing in the morning is optimal. So when you get up, kind of let your legs dangle on the bed, take some deep breaths and grab your blood pressure and write it down and start keeping record of that. We're okay with the wrist cuffs. They're okay as long as you're sitting without your legs crossed, your feet are on the floor, you're sitting in a normal position, and that wrist cuff is at heart level. If the wrist cuff is too high when you measure it, it might show your blood pressure to be low. If the wrist cuff is low, it may show your blood pressure to be too high. So just make sure it's at heart level, and the wrist cuffs are great. The goal obviously is to keep it under 120/80. Treatment, things like exercise, laughter, mindfulness, proper sleep, optimal vitamin D, low sodium, hydration are all great techniques to get blood pressure to get to that optimal level. If those don't work, consider treatment with certain blood pressure medicines, specifically ACE inhibitors, and I'll explain why in a moment. But don't be afraid to treat blood pressure. Be afraid of having a blood pressure that's killing the neurons and the microvessel of your brain. That's more of a concern than treating blood pressure. Okay, number 8, healthy gut, healthy brain. Eating things like pro and prebiotic foods, getting at least 25 grams of fiber a day. Coffee has actually shown value for brain health, which I love because I love coffee. Things to avoid things like saturated fats, avoid all artificial sweeteners, and avoid all soda drinks. And avoid foods that you know drive inflammation in your body. Some people have inflammation driven by gluten, and there's genetic tests for that. Some people have inflammation driven by dairy. Know your body, and if it drives inflammation, whether it be manifest in your joints or in your gut, realize that affects your health systemically. But for everyone, whether we know it or not, avoiding saturated fats is going to reduce inflammation. Avoiding artificial sweeteners of any kind and avoiding soda all can help reduce inflammation, and then getting these other things in check as well, as far as fiber and pro and prebiotic foods. Fermented foods carry it all, right? Pro and prebiotics are just slammed in these fermented foods. Fiber is found in natural foods as well, and coffee is pretty much found everywhere. Know your sugar numbers. As I said to you previously, 80% of people who have Alzheimer's are either diabetic or pre-diabetic. So know your numbers. Insulin resistance, as I said, 80% of Alzheimer's patients are either insulin resistant or diabetic. Fasting blood sugar, when you haven't eaten for 12 hours, should always be under 100. The 3-month average, it's called hemoglobin A1C, should stay under 5.7. We always do glucose tolerance tests on our patients because we want to find out insulin resistance or prediabetes as early as we can. And doing a glucose tolerance test is the earliest way to find it. So after you have a sugar drink, it has 75 grams of sugar in it. It's a calculated test. Your 1 hour glucose should be under 125, and your 2 hours should be under 120. If you are diabetic, it's critical to protect your brain by keeping good, tight glucose control. That's essential. So please keep that in mind. Lastly, number 10, certain medications that we use to protect the arteries around the heart also protect the arteries systemically, and also protect the brain from Alzheimer's disease. I'm going to cover just a few of those. Baby aspirin. There's data to show that baby aspirin decreases cognitive decline in women. We are not suggesting that you take any of these without consulting your healthcare provider, but we wanted to show you the data. Also statins, like rosuvastatin or Crestor or Pravastatin or Pravachol, Simvastatin, which is Zocor. These medications, while they're often prescribed for cholesterol management, that's not really their benefit, by the way. Their benefit is their anti-inflammatory effects on the body, including the arteries and the brain. Do you know that statins reduce the risk of dementia and Alzheimer's by 25 to 50%? 25 to 50%, regardless of cholesterol, by the way. They are one of the best anti-inflammatory drugs we have to protect the inside of our body, specifically the arteries. ACE inhibitors, as I mentioned previously, that are great for blood pressure, but going beyond blood pressure, ACE inhibitors have shown that they can slow cognitive decline and reduce stroke risk by 32% and decrease cognitive decline or dementia and Alzheimer's as well. It works by effects that are different than blood pressure management. So it works by delivering nitric oxide, it works by vasodilation, it works at decreasing inflammation. So a lot of these treatments have value outside of what their intended use is. And I think that's important to realize. And then since insulin resistance is such a powerhouse in diabetes, it's of no surprise that a medication called pioglitazone, which we use often to prevent diabetes, it reduces diabetes risk by 72%, which is great. It also has shown at low doses to be a treatment for Alzheimer's patients. It regulates the metabolism of insulin, carbohydrates, and glucose. And so these are treatments we have found over the years that we use to protect the arteries systemically. And it's wonderful that the data is showing, aha, it also protects the brain, which is wonderful. Okay. A quote that I like, because I'm living it, my brother's living it, is the following. One of the hardest things you will ever have to do, my dear, is to grieve the loss of a person who is still alive. The author of this is unknown. And when you see a loved one slip away from memory, the ultimate reality is we all as humans have to think, is it going to happen to us? But what we know now, the generation before us didn't have that knowledge. So we are extremely optimistic that we can do something different. Our trajectory for health span matching our lifespan is so glorious. So we're actually really excited as we move forward with learning more and sharing it with you along the way. So with that, I thank you all very, very much. And I'm going to close on this slide, which just simply invites you to join us, join the community. Go to our website at Bale-Doneen.com. This program and others will be posted so you can review it. You can share it with friends and family of people that you wish were listening to it with you right now. And we'll have it up there to use as you wish. We'll also have upcoming programs listed, such as the Women's Heart Health program I'll be doing in February. It's for everyone, just like this. Also for providers of all specialties, medical, dental, health sciences, nutritionalists, anybody that has the ability to work with patients is invited to our preceptorship program, which is a certified medical education backed by the American Academy of Family Practice, 17 hours of CME, which is great. That's February 19th and 20th. And then ultimately stay educated. Watch our video series on there. It's called Arterial Health Assurance for Life. Stay up to date with our blog posts. And if you haven't read our book yet, called Beat the Heart Attack Gene, make sure you grab that on Amazon and give it a read. I think you'll find it very absorbable, readable, and it'll highlight some of these things we've discussed this evening. And be ready, because our next book is coming out in about a year from now, and it's going to focus on microvessel systemic health, including protecting our brain as well. So I want to thank all of you, and I'm going to bring Dr. Bradley Bale onto the screen with me, and Kramer's going to moderate some questions. And for those who want to stay on or have questions, you're welcome to do so. And I welcome Dr. Bale on the scene as well. So hello, hello.
Yeah, great. Well, let me say a few words first. Wonderful job with the presentation. This is an extremely exciting time that we're living in now. And it reminds me of 20 years ago when we realized people don't have to have heart attacks. They can be prevented. Now we're realizing people don't have to develop Alzheimer's. It can be prevented. How fantastic is that? It's wonderful. And you did a great job. The only thing I question when you're talking about action items to prevent Alzheimer's is engaging with technology. Sometimes I think I find that more challenging than helpful. It gets frustrating.
Get your brain thinking there. Get your brain thinking, Professor.
Great job.
Thank you.